The numbers are consistently on the rise of children being afflicted by hunger and malnutrition in northeast Nigeria following more than a decade of insurgency and banditry in those parts. According to an integrated food security phase classification projections for October to December 2024 and January to April 2025, nearly 5.4 million children aged between 0 and 59 months in northwest and northeast Nigeria are suffering from acute malnutrition and would likely continue suffering through 2025. This includes about 1.8 million cases of severe acute malnutrition and 3.6 million cases of moderate acute malnutrition. We're now being joined here on Newsday by Khatija Nxedlana, Communication Coordinator at International Committee of the Red Cross, to examine the alarming levels of malnutrition in Nigeria's northeast and what could be done to remedy the situation. Good to have you on Newsday. Thank you so much for joining us.
Thank you so much for having me and for this opportunity to speak about this all-important topic.
So what would you say are the primary factors contributing to rising malnutrition cases in northeast Nigeria, and what do you think can be done urgently to remedy the situation?
Years of conflict in northeast Nigeria have displaced families, restricted access to farmland, and disrupted local food production. This poses a huge challenge for communities who live off agriculture and livestock. In addition, we're seeing climate shocks, including torrential rains and flooding, which significantly hamper agricultural productivity. We're seeing farmers having to walk long distances in order to be able to access fields, to be able to grow crops. And the reality is, if they're unable to plant now during the rainy season, they will have little to no food come harvest time. So for the International Committee of the Red Cross, we have an agricultural assistance program. This year, we have provided 21,000 farming households with seeds that are catered towards local climate conditions, and also seed planting tools, which help to reduce the labor burdens that are placed on farmers, but also to improve efficiency so that farmers are spending less time on the fields. Our support also includes field crops and vegetables, including rice, maize, tomato, and okra, amongst others, contributing to nutritional value and dietary diversity. Farmers are also trained in sustainable farming practices so that they're able to continue these practices long after any humanitarian or ICRC intervention. Now, as you rightly point out, we know that food insecurity contributes to malnutrition. So the ICRC also supports health centers, which are called malnutrition stabilization centers, which are aimed at detecting and treating cases of malnutrition, particularly with children under the age of 5 and pregnant or breastfeeding women.
Oh, that is, thank you for that. And to what extent is improved security in the region a bit of a prerequisite for long-term food security and agricultural recovery in the Northeast, despite all the programs that are on ground?
It is absolutely imperative that farmers and farming communities are able to access fields to be able to plant safely. We are seeing a number of people that we spoke to in the Northeast who need to balance caring for their children while also trying to provide on a daily basis food for their families and also to sustain themselves.
Well, Khatija, let's talk a bit about how malnutrition affects children under 5, pregnant and breastfeeding women, and what are the long-term consequences?
Absolutely. So we are already seeing alarming statistics, and the main concern is that without sustained intervention, these statistics are likely to rise this year and years beyond. So for the International Committee of the Red Cross, this intervention that we provide to the health facilities, to the malnutrition stabilization centers, is part of our approach to sustainable humanitarian impact, so that the support does not only cover this year or the next, but is really aimed at a long-term solution.
And how would you assess the current partnerships and your partnership with the NGOs, local organizations, and individuals on ground in these affected areas? Are they mitigating the crisis efficiently enough, and what could be improved in order to do that?
So I do think that one challenge that we face as the ICRC It's not, unfortunately, unique to the ICRC, but across the humanitarian sector as a whole, because what we're seeing is increasing needs, while at the same time a general reduction in humanitarian funding across the board. So what we really need to also improve on is working with local partners, working with local authorities, such as in the instance of food insecurity for the ICRC in the Northeast, we work with the National Agricultural Seed Council, also repairing a key water source in order to improve their seed testing facilities as well as greenhouse facilities.
So what role can community education and support play in promoting proper nutrition and care for vulnerable children? Community-led
interventions are essential, and this is what we promote as the ICRC as well. For instance, we have the Tom Brown Project, where we teach local communities on nutritional meals that can sustain communities, that can sustain children, and the importance of training further communities to be able to lead these training sessions without humanitarian intervention as well. It's imperative that these solutions are community-driven with support from humanitarian organizations such as the ICRC.
And how could a resilience be built within these affected communities in order to withstand future shocks, even when the ICRC are not on ground or other aid organizations?
Right, so through the numerous interventions that we had, one of which I've already mentioned, which is the distribution of seeds and seed planting tools. We also have poultry projects. We also have the Tom Brown Project, helping to treat and prevent, rather, malnutrition. But these solutions will then be carried forward by communities and in that way become sustainable and long-term in order to not only prevent malnutrition, but then to also be able to address food insecurity in the region and as a whole.
So can investments in agricultural infrastructure, probably such as irrigation systems and storage facilities, help improve food availability and reduce malnutrition?
Yes, this is correct. And this is why through our engineers and the department that we call our Water and Habitat, they invest heavily into repairing and rehabilitating key water sources in various areas across the Northeast in order to help local communities, in order to help local authorities to be able to access clean and safe water for use and consumption.
And in your opinion, how can these displaced farmers, how can they be returned back to their lands and be supported in order for them to return safely and continue the cultivation of their crops?
Right, so there needs to be safe access to land. Of course, everyone wants to be able to return home, but these are interventions that may take time. This is something that the ICRC is supporting with, because what we want to do is to be able to support communities who are affected by conflict. Our interventions are solely based on the needs, and as a humanitarian organization, we want to be able to support these communities in whatever way, be it through initial emergency response and then longer-term solutions, so that they're able to return to their homes, return to farms where they once grew crops and were able to nourish their own families and their own communities. This also helps to improve their durability, their sustainability into the long term, and as well as giving them back their dignity and independence.
Well, Khatija Nxedlana, Communication Coordinator of the ICRC, thank you so much for joining us on Newsday.